Hello, welcome to PHI Clinic. We find ourselves in the basement theatre room. I'm joined by my wonderful colleague, Dr Priya Verma, and she is performing the Endolift procedure, for which she is quite rightly very famous. Priya, tell me, in short, how does this treatment work?
Hi Tapan. So the Endolift procedure works by using this really thin hair-like fibre that you can see me passing back and forth through the skin. It uses light energy, which converts into heat, which causes a nice tightening effect on the skin. And in some patients, if we need to, we can even melt little pockets of fat with it.
That is fantastic. Now, what is that little crackling sound that we can hear?
Great question. So that crackling noise is actually a very reassuring sound, and it just tells us that we're in the correct layer and depth of the skin. We're coming into contact with water and fat cells.
Brilliant. So let me ask you a different question. Obviously, as you said, some patients just want skin tightening, some will need a little bit of fat loss as well. So can you adjust your device to get that balance of outcomes?
Absolutely. Now that's the beauty with an Endolift procedure, is that you can be as bespoke as you need to be for the patient in front of you. So if we've got a patient who has, let's say, very little fat on the face or the neck, and they just want to have a pure skin tightening treatment, then we just adjust the settings to ensure that we're creating very little heat energy so we don't disrupt the fat. And on the other hand, if we've got a patient who's got a little stubborn pocket of fat under the chin, which is quite a common complaint, then we can increase the settings based on what we see to generate a bit more heat and melt the little pocket of fat. So really it's individual and personalised to the patient in front of us.
Brilliant. Now, as I'm observing, our patient looks wonderfully composed, calm and relaxed. She's barely flinching. Can I ask you, are you as comfortable as you appear?
I am.
So on a scale of 1 to 10, 1 being no pain at all and 10 being the worst pain you can imagine, give us a number.
1 or 2.
1 or 2, that is fantastic. And so she's just had a little bit of local anaesthetic, Priya, and I think, would you agree that's another advantage of this procedure, just the ease of which you can perform it with?
Absolutely. Endolift is a clinic-based treatment. It can be just done in a simple room where, all we need to do is infiltrate the skin with a little bit of numbing. And all that means is we're getting a bit of liquid anaesthetic, injecting it under the skin in small amounts to the point where you're comfortable for the procedure, but once you leave the clinic, it should have worn off by then.
Wonderful. Now, in full transparency, I've got to let everybody know that I was first trained in this procedure about 2 years ago by wonderful Dr. Priya here, and I have to say it was without doubt the best training that I'd ever received. And I know you've trained a number of my colleagues. Some of the biggest names in the industry went and got the device, and you trained them as well. So you're obviously one of the most experienced, if not the most experienced practitioner in the UK. But tell me, from a treatment point of view, what are the most important considerations according to you?
Well, as with any treatment, you want to be going to have your treatment with someone who is experienced in the procedure you're having done. Someone who really understands your skin concerns, takes the time to listen to you, understand why you're having a treatment, ensuring that this is the right procedure for you. So every time I see a patient, we'll make sure that we have a thorough consultation beforehand. Patients are given the time, the opportunity to go away, think about it, consider their options, and then they come back when they feel completely comfortable. Now, the other thing to say is that sometimes we need to do more than one treatment, or we need to combine our treatment with other devices or other treatment modalities. And so you need to trust the judgment of your injector, of your doctor or clinician, to know that they're doing the right thing for you and that they're recommending things based on what your true skin concerns are.
Brilliant. One of my real memories of when you trained me was just how meticulous you were with every aspect of it, whether it was administering the anesthetic, whether it was making sure that the same amount of energy was put through the different parts of the face. And that really was a wonderful instruction for me. But what has been some of your learnings on your journey about what it takes to be a great practitioner and the considerations that are important for any patient as well?
And That's such a great question. Thank you, Tapan. The important thing to know is that with every device, with every treatment, there is a learning curve. And so the reason I'm meticulous in the way that I teach it is because I know there is going to be a period of time where it takes a practitioner to get used to the device and get used to the treatment. Ultimately, the take-home message is practice makes perfect. So seek a practitioner who has a wealth of experience with using the Endolift device and someone who will really only treat the right person. So patient selection is key. You can't get an outcome, a successful outcome, if you're choosing the wrong patient to treat.
And that's such an important thing, because obviously the worry with all these devices is that they're touted as suitable for everyone. But you and I both know that patient selection is just so important.
Absolutely. It's really just, it requires a thorough consultation, something that, we pride ourselves on offering here at PHI Clinic. An opportunity for a patient to discuss their skin concerns, the time to go away and have a think about whether they want to pursue this treatment, and also having trust and faith in their practitioner that they will offer them the correct treatment option.
Great. Now I can see that you're coming to the end of the treatment here, and so what do you use to decide what the end response has been?
So in order to decide whether we move on to the next area of treatment, we always use what we call tactile feedback, so the use of your hands. Now, as you can see here, I've been treating this patient's under chin area. She was concerned about loose skin. I've just nearly finished this treatment, and can you see how, although you haven't seen the start of the treatment, there really is no loose skin here. It's nice and firm. It's firm throughout. This tells me that we've already reached an endpoint. We've already reached effective skin tightening in this region.
Fantastic. And I have to say, I don't know if it kind of makes you cringe as much as it makes me cringe, but would you also agree that this is one of those treatments in which we may see something at the end of the treatment, but patients have to wait a long time? I mean, I've seen examples of people finishing their Endolift, being sat up and being given a mirror. I mean, at that point, they're full of anaesthetic, they're full of liquid, we're not removing the fat. So if anything, would you admit that patients often will look a little bit worse when we finish, when they walk out the door, but they improve over a time period?
Absolutely. So look, what you need to understand is that there's a number of reasons why you might look like you're firmer, more lifted, tightened immediately after a procedure. And as Tapan, you've said, it's because we've just put anaesthetic in. So if there's loose skin and you add volume to that, even if it's just a little bit of local anaesthetic liquid, it will give you the effect that you're a bit firmer. We are manipulating the area, we're touching it, we're feeling it, that's going to add a little bit of swelling. Now, the laser itself, as I said before, is essentially distributing heat under the skin. That's going to cause a bit of skin tightening as well. The true test is to see a patient at a month, at 3 months, at 6 months, at those regular time intervals to see the evolution of the result. Because often, you'll see an immediate improvement, but it might drop, but that's okay. That's what it's supposed to do. Collagen stimulation, which is what's going to give us tightened skin, doesn't happen for about 3 months on average in most people. So really, that's what you should be looking for before and afters that are not the immediate result, but before and afters that take place around 1 to 3 months.
I think so. And I think one of the real take-home messages there is just beware of gimmicks. I think there are times when you can genuinely see the improvement in a mirror, and I think, for instance, soft tissue fillers is one of those. But even then, we know that those results get better and better over time as well. But this is not one of those where, you pop in, have the treatment, look in the mirror, everything is absolutely fabulous, and then you go home. So it's important that if you're the patient, you need to be patient, and it's going to take time for those results to really come through. Priya, thank you very much for your words of wisdom. You have one lucky patient there, and I'm very excited to see what her outcome is going to be. Thank you.